So we already talked about a reference point. Always start out with iliac crest. Doesn't matter what position the person is in, supine, sideline, prone, rather than doing this on patient, just always start out. And of course, you get their consent, you tell them that you're going to be feeling around their tissues and their spine in the back, if that's okay with them. So I'm assuming Laura's okay with me doing it, right, Laura?
No problem.
So start out with this. What was that?
No, okay, fine.
And the level that you are likely to get to at that level, at that point, is L4 or between L4 and L5. That's one reference. The other thing you can do, so I would just put a mark there or something, and then start out with the rib cage. So get to the inferior angle of the rib cage on the opposite side. And so I feel that. That's easy to feel. Everybody should be able to feel that, right? If you can't feel that, we're in trouble. And then kind of like follow that to the spine. And what level is that going to be? T12. From there on, you count down, and I want you to kind of rub through the spinous process, so you kind of get to understand and feel. I'm going to put a spine model right on your back here. And these models, I guess this is not too bad, but remember I talked about it, the different shapes of the spinous processes in lumbar spine versus thoracic versus cervical, right? Okay. So as you're counting down from T12 or L5 up, I want you to kind of rub your thumb over the width of the spinous process in the lumbar spine. And you will notice that L1 through L4 are all the similar height or the size. And they're pretty large. And so you go through it, I would say they're kind of at least the size or the width of your thumb, perhaps. Depends on your thumb size. Okay? But kind of go through it up and down, and you will be able to then fall into that interspinous space, move on to the next one, fall into the interspinous space, and so on. That you should be able to count this. When you get to L5, L5 is a very different shape of the spinous process. And this model is really good. Sometimes the models don't represent accurate anatomy. It's very small. It's kind of like a small button. And you should be able to palpate. Now, some people are hard to palpate, some are easy to palpate, so try to switch around your partners. I think that would be easier. But L5 feels much different than the remaining of the lumbar spinous processes. The other thing you can do is have your partner in this prone position. Once you think you are on the L5, have them do anterior tilt just a tiny bit. It will disappear. If they do a posterior tilt, it would come under your thumb. So play around with it. Again, this will take a little practice, right? So let's go through this on Laura here.
What level disappears if you anterior tilt?
L5. Yeah. It's kind of like C6. You guys remember that with neck extension? It's the same analogy. Can I pull your shirts down a little bit more? So I think I'm here on 5. I can put a mark here and start from the top, but I think I'm good. I'm just going to go ahead and leave this as L4, move on to L3, 2, 1, and T12, and I can confirm with this angle of the ribs, okay? One thumb was on L4, so now I want to make sure that, yes, indeed, that was L4. Let's find L5, and have you go and anteriorly tilt just a little bit, okay, and relax. That was a little too much. Go slow, okay, and come back up, and do a posterior tilt, and relax, and you can feel that under your thumb. So that's how you would want to palpate. Good with that? Okay. So I want you to practice this. But let's move on to this.
How do you get the patient to anterior
Yeah,
tilt?
that's the problem. You really, and that's a whole different discussion on another day. So at least you practice on each other to kind of get good at it. And then use the bony landmarks of iliac crest and the rib angle. And your palpation skills to differentiate what L4 feels like and what L5 feels like. We will go through the tilting of all this and how do you teach your patients, but we start out in supine, so you're seeing them, they're seeing you, and you can kind of use, you can explain them better. When they're in prone position, it's really hard for them to do that. Most people don't know what anterior posterior tilt is, and even if you explain that to them, they're doing it the opposite of what you want them to do. All right, what's next on the assessment exam sheet? Palpation. So that was my bony palpation. Skin. Okay. So the other thing we need to do is look for, we're going to assess soft tissues. And we have a whole lab, so you get to do a lot more. But in terms of just the spine and a quick assessment of the soft tissues, the first thing we need to do is check for temperature. So using the dorsum of your hands, I'm just going to put a light, I'm just going to rest my hands lightly on Laura's back. And you're feeling for heat. So obviously, you shouldn't be feeling heat on anyone today, but just imagine that somebody with a herniated disc or some sort of inflammation, you will literally feel heat on the dorsum of your hand. And you don't have to push hard, it's just really light push. Okay? All right, so that was the assessment of the inflammation or acute inflammation. Then we're going to do what we call a scratch test. And Laura, I'm not going to hurt you, but I'm going to kind of do a little bit of a scratch test on your back. So using the back, your nails, you're going to kind of stretch or put some sort of a mark on her back. So I'm rubbing through both of her muscles, one on each side, and you see a red streak. So that's a histamine response you're looking for. Just using the fingernails, okay? Just kind of rub across her back. And within, a few seconds, you should see redness. If there's a break in that redness, then it makes you think that something is going on with that segment. We don't know what it is. That's not diagnostic. It just basically says that there is something that's perhaps not quite right with that segment. You'll make a note about it in your assessment and move on, and of course do other tests. Okay? So this is looking for histamine response, redness in the skin with a scratch test.
And you're trying to get on the bulk of the muscles?
Yeah, I'm on the muscles right now. Okay.
Is that scratch or stretch?
Scratch test.
Okay.
Got it? Okay. Next thing is a skin rolling, and this takes a little bit of practice. Apparently I found out some students were, I don't know, picking up the skin or who knows what they were doing in another lab. So I am going to, so the skin, you should be able to do a kind of a skin roll on people's back. So I'm just kind of, see what I'm doing here. And she's not too bad. She's doing pretty good. Does it hurt? Okay. Some people, you cannot do it, or you can do it and you get to a segment where you feel like you can't pick up that skin and you just kind of have to kind of go over it. So there's a lack of skin mobility at that segment. Some people will also have pain with it. So that is another indication that something might be going on with that segment. Again, not diagnostic, but perhaps one more positive finding. So the skin is, the fascia underneath the skin is attached to the spinous processes, right? So as you're moving, flexion, extension, all that, that fascia has to stretch. And with this assessment, you're just assessing how well the fascia is moving. Sometimes people have a pain with that, so you will document that. It could be the irritation of the medial cutaneous nerve that would cause pain. But people who have a lot of arthritic changes and something going on with that segment, you will notice that there's a thickness in that area and the skin test is positive at that segment. Okay. So when you're practicing it on each other, think about using your thumbs as drivers rather than doing this. Yeah? Good with that? All right. Now moving on to the accessory glide, the central PAs. There are 4 grades. So tell me the definition. What's grade 1? No. Grade 1.
The first 25%.
Okay, so the first 25% of their movement. Is it large amplitude or small amplitude? Small amplitude out of resistance range. Okay. What's grade 2?
First 50%.
First 50%, okay, or middle 50%, right? No, first 50%, sorry.
Okay.
No, just checking on you. Is it into resistance, out of resistance? Out of resistance, and is small or large amplitude? Large amplitude, okay. What's grade 3?
50 to 100.
Okay, somewhere 50 to 100%, 25 to 75%, something like this. Are you into resistance or out of resistance? Into, out of. Amplitude? Larger. And grade 4? Small into resistance. We stay towards the end. Okay. So grade 1 and 2. Now imagine how much translation people have. 1 to 3 millimeter, right? And we're not trying to create motion with 1 and 2. So how much motion are we talking about? Very, very little. Your hand position, if you recall from the lecture, is just 2 ends of the thumb, right? And not the pads of the thumbs. I don't want you to put the entire thumb. It's like tip to tip, I guess. I don't know how to say it. And then I'm going to lower the tip a little bit. My thumbs are close together. My IP joints are straight. They're not hyperextended. And I'm just applying just a tiny bit of pressure. I'm just breathing. That's all I'm doing. And like I said, you would feel like, really, this is it? But somebody who has acute disc, they would not be able to tolerate it. Just the pressure of your hands, they would not be able to tolerate it. And so I'll go through all segments. Okay. One more thing too, very important thing, is her hand position. They should be down here. Okay? Because what happens if they're up here? Yeah, potential extension of the back, tightening of the thoracolumbar fascia. So with the lumbar spine, the arms are down here. With thoracic and cervical spine, arms are in different position. So that's what grade 1 looks like. Grade 2, same thing, a little bit more motion.
So you're pushing straight down.
Straight down
On the spinous
on the spinous processes. Straight down towards the floor. And my hands are kind of like, fingers are like spider legs. Got it? Okay, so that's 1, 2, all the way. For 3s and 4s, you're using the lateral border of your hand. I would say distal to pisiform. You don't want to be on pisiform. My caudal hand is right over her spinous process. My cranial hand is going to be over my right hand and reinforce that pressure. And I'm going to have Laura scoot towards me just a tiny bit. Very good. Okay, thank you. And this is what my grade 3 is going to look like. And I'm going to go to the next level. So this segment seems stiff. I don't know who her partner is. So I would go up and down like this. That was grade 3. Everybody got it? It will take a little practice, and hands have to be relaxed. The pressure is coming from, I would say, entire body, but I'm pressing down more with my left arm. And then 4 is pretty much getting down there and then oscillating, a small oscillation. Okay.
Does it matter which hand you pick to be
Not in the lumbar spine, but perhaps in the thoracic spine because of the natural kyphosis. If you're using this hand versus then, maybe you can bias your pressure direction a little bit. But in lumbar spine, no, it's whatever works for you. Most people that I have seen, including myself, is the right hand down, the left hand on the top. And I'm a right-handed person, very much so. Okay, good with that? So you're going to practice bony palpation. Make sure you know your landmarks. Temperature, skin scratch, skin roll, central PA.